Alright, hello again, class. So this is the second portion of our discussion on microscopic analysis. Okay. And of course, ito na po ang mga iba't ibang sediments na pwede nating makita sa ating urine sample. So what are the different sediments? So take note. Yes, take note that your sediments, they are generally classified as either organized or unorganized sediments. Okay? So what are the different organized sediments that we are able to see? Yes, we are able to see in your urine sample. So this would include, of course, your cells, okay, your casts, and other miscellaneous structures such as your mucus threads, your bacteria, your yeast cells, your parasites, and your spermatozoa. Okay? So lahat po yan ay classified under your organized sediments. Okay? So sabi natin, dalawa yung classification. So syempre, kung meron tayong organized sediments, we also have what we call your unorganized sediments. So basically, when we talk about your unorganized sediments, we are referring to your crystals. Siya lang. Okay? Siya lang. Mag-isa niya doon sa unorganized sediments. And so, para mas effective ang ating pag-aaral at para, syempre, matandaan natin agad-agad sa exam, okay, or pag tinanong tayo, i-memorize mo lang yung unorganized. Kasi the others naman, iisa lang sila, puro organized naman yung iba. Nakuha, basta alam lang natin na si unorganized, mag-isa lang yan, si crystals lang yan. Okay? So unorganized crystals lang po. All the other sediments are classified under your organized sediments. Alright? Alright, so specifically, ano yung mga cells na pwede nating makita under the microscope? We have your erythrocytes, your leukocytes, and your epithelial cells. So take note, class, na pag ang pinag-uusapan natin ay ang ating mga cells, okay, saan nanggagaling? Saan nanggagaling yung ating mga cells sa urine sample? So there are basically two sources of cells or two reasons why cells are present in your urine sample. So number one, yung unang reason natin, so your cells, they may be present in your urine sample due to the normal physiologic process of desquamation. Okay, desquamation or exfoliation of the epithelial lining of your urinary tract or urinary system. Yan, so magkakaroon ng cells doon sa urine sample natin. Okay, so of course, merong normal desquamation or physiologic desquamation na tinatawag natin. Meron din pong pathologic desquamation. So there are certain disorders or diseases which will, okay, result to a faster desquamation or exfoliation of your cells. Alright, leading to the presence of your epithelial cells in your urine sample. Okay, another, the cells that are present in your urine sample, so they may also be of hematogenous. Okay? Hematogenous or hematogenous origin. Alright, so from the term itself, hematogenous origin, saan sila galing? Hemato, sabi niya dyan. Okay, so hemato, ibig pong sabihin, they come from the blood or they come from the circulation. Okay, yes, so blood or galing po sila sa circulation. So say for example, there is this particular condition which will compromise the integrity of the different blood vessels which are present in your urinary system. Okay, so of course, since your blood vessels are injured, the blood cells that are present in the circulation will now go to your Yes, urine or to your filtrates. Yes, thus they are demonstrable in your urine sample. Okay, so those are the two reasons why cells may be present or may be observable in your urine sample. So again, ano yung mga cells na yan? We have RBCs, WBCs, and your epithelial cells. Okay, so another organized sediment which may be present, we have your casts. So there are several forms of your casts depending upon factors, okay, which will contribute to its formation. So we have your hyaline cast, we have your RBC cast, we have your WBC cast, epithelial cell cast, granular, waxy, broad, and fatty casts. Okay, so we will all be discussing all of these casts later when we go to that portion. And then of course, we have your miscellaneous structures such as your mucus threads, your bacteria, yeast cells, parasites, and of course, your spermatozoa. Okay, so all of these are organized sediments. Ano lang ang hindi organized or okay, ano lang ang hindi organized or unorganized? Very good. Okay, we have your crystals. Okay, so yan. So before we discuss each and every one, each of these sediments, yes, it is very important also for us as medical technologists providing the results for our urinalysis to know how are we going to report the presence of these different sediments. Yes, energy level naman dyan. O baka mamaya inaantok ka ha, huwag kang antukin kasi importante po ito. Okay, yan. So punta tayo sa microscopic quantifications ng ating sediments. So pag sinabi natin class na microscopic quantifications, so these sediments are actually reported as word per LPF or word per HPF. even if we make use of words in order to report these different sediments, okay, meron din pong provide na ranges or quantities in order for us to know whether to make use of the word rare, few, moderate, or many. Okay, so ibig sabihin, binibilang pa rin natin sila. So kahit na ang reporting natin sa mga sediments na to ay word per HPF or word per LPF, binibilang pa rin po natin sila at kung saan nag-fall yung average niya in 10 LPF or in 10 HPF, yun yung gagamitin natin na word. Okay, for the reporting of your sediments. So what are the different sediments which make use of microscopic quantifications? We have your mucus threads, yes. We have your epithelial cells, okay? Particularly, ang epithelial cells po na sinasabi natin dito is your squamous, kasi depende po yan di ba? Marami pong iba't ibang epithelial cells. So ang nire-report po natin word per LPF ay si squamous epithelial cells. Okay? So yan, per LPF po silang dalawa. Mucus threads and squamous epithelial cells. Kaya nga, when, sorry, naglag. Okay? If you go back to the video which we provided to you, di ba? Sabi ni Sir Ruben, oh, nasa LPF tayo. So, kung nasa LPF tayo, bilangin na natin si squamous epithelial cells, okay? Kasi LPF siya di ba? And of course, along with your squamous epithelial cells, pagkatapos natin siyang basahin na din natin si mucus threads. Kasi parehas lang naman sila na LPF. Okay, ayan. Alright, so for the microscopic quantifications naman of your bacteria, so it is reported as word per HPF. Okay, word per HPF po ang bacteria. And of course, we have your crystals. Okay, so take note class na dalawa ang klase ng crystals na pwede nating makita under the microscope. So in general, they can be classified as normal crystals or abnormal crystals. Okay? So what type of crystals are reported as word per HPF? Yan yung mga normal na crystals. Okay? So normal crystals are reported as word per HPF. Okay? Along with your bacteria, which are likewise reported as word per HPF. Okay? So I think na explain naman ito ng mabuti ni Sir Ruben doon sa video. Okay? So paano ba natin siya ginagamit? Okay? So of course, say for example, dito tayo sa mucus threads. For example lang ha. Yan, mucus threads tayo. Okay? So say for example, 'di ba, sabi ni Sir Ruben, maglagay ka ng mga fields. So 1, 2, 3, 4, 5, 6, 7, 8, 9, and then 10. Okay? Bakit 10, ma'am? Kasi yan nga ang kailangan, 'di ba? 10 LPF or 10 na HPF. Okay? So sa first na sa first na field natin, ilang mucus threads ang nabilang natin. So say for example, meron kang 5 na nabilang. Okay? So sa pangalawa, meron kang 2 na nabilang. Okay? Sa pangatlo, meron kang 1 na nabilang. Okay? Sa pang-4, wala kang nakita. Sa pang-5, meron kang 3 nakita. Okay? And then 6, we have 4. And then, example lang to class ha, para at least alam nating lahat. Okay? 2. And then, 3 ulit. And then, 1. And then, 1. Okay, so say for example, ito po yung reading natin. Alright, so 5, 2, 7, and then 8, 9, 10, 11, tama? Plus 4, 15, plus 2, 17, okay? Plus 3, 20, yes, plus 9, plus 1, 21, plus 1 ulit, 22. Okay? So, ang total na nabilang natin sa 10, di ba? Ang total na nabilang natin sa 10 na LPF ay, okay, ilan na ulit yung sinabi ko kanina? 22. O, di ba? Tama ba ako? Ulitin natin kasi mahirap magkamali sa math. 5, 7, 8, 11, 15, okay, 17, 20, 21, 22. Okay, so since ang reporting natin ay per LPF, ilan ang ginamit mo na LPF? 10. So dapat i-divide natin ito. Okay, so we have to divide it by 10 para makuha natin yung per LPF na sinasabi ni Sir Ruben. So kung i-divide po natin yan, so meron kang 2.2. Okay, yes. So meron ka pong 2.2. Okay. So doon sa ating table on microscopic quantification, wala tayong problema. Kasi si 2.2, okay, 2.2 mucus threads per LPF, it falls under 1 to 3. Tama? Diyan siya magfo-fall. So we have 1 to 3. And so, how are you going to report it? You report it as few. Naku ha? So, ganun lang siya kadali. Okay? So, same is true with your epithelial cells. You just have to count ilang epithelial cells ang meron per field, per low power field. Okay? And then, you have to consider 10 low power fields, get the average of that, and then kung saan po siya magfo-fall, yun ang ire-report mo. So, say for example, in 10 low power fields, okay, ang na-compute natin na average ay 17, for example, na epithelial cells. Okay? So, si 17 epithelial cells, it would fall under 5 to 20, which should be reported as few. Okay? So, ganun lang po siya. So, ganun din kay bacteria. So, say for example, dun sa bacteria natin, nakapag-count tayo ng 9 na bacteria. Yan ang average niya per high power field. So, kung 9 bacteria, Okay, so magpo-fall po siya under dyan and we are going to report it as rare. So say for example naman, sobrang dami ng bacteria. Okay, sobrang dami ng bacteria at nung kinount mo siya, nag-fall siya as 300 per HPF. So kung 300 per HPF, dito po siya magfo-fall greater than 200. So it should be reported as many. Okay, so many naman ang reporting ng bacteria na 300 per HPF. Okay? So, ma'am, why are you telling us this? Wala. Joke. Hindi. Sorry. Hindi kasi in the board exam, okay, during my time, ang tinatanong lang nila, during my time yan ha, just imagine kung gaano lang yan ka-recent. Okay? Ayan, akala nyo ha, hindi po ako fresh medtech po ako. Okay, so during my time, ang tinatanong lang nila is the manner of reporting. Okay, so you're just going to indicate kung word per LPF ba, word per HPF, average number, so on and so forth. But recently, okay, in the recent board exams that we had, ang nilalagay na po nila ay yung number, okay, ng sediment. So say for example, in one board exam recall question, nakalagay doon na meron daw siyang na-count na 40 bacteria, okay, per HPF. How should the medical technologist report 40 bacteria per HPF? Okay, so kung 40 bacteria per HPF, it would fall under 10 to 50, okay, and it should be reported as few. Okay, ganun na po sila magtanong sa board exam. So, kumbaga, nag-level up na sila. So, that's why we also have to emphasize. That's why I am emphasizing this table on microscopic quantification so that kung mag-board exam ka man kinabukasan, at least alam mo na. Okay, so yan po. Do not forget microscopic quantifications of your sediments. All right? So when it comes to the manner of reporting of our sediments, of course, I also provided a summary of that. Okay, so ganito po sila nire-report. So we have your RBCs and WBCs. Nire-report ba natin sila as rare, few, moderate, or many? Hindi po. Why? Because the reporting of your red blood cells and your WBCs is average number per 10 HPF. So actually, it depends upon the laboratory, yung ranges. Okay, yung ranges na pag-report dito sa ating mga average numbers. Okay? So doon sa ating module in our laboratory, okay? And I think Sir Ruben was able to explain this naman okay, sorry, okay, in a simple way. Okay, so say for example, our BCs 0 to 2, 2 to 5, 5 to 10, 10 to 25, 25 to 50, 50 to 100, or greater than 100. So actually, depende po yung range doon sa institution. Kasi may mga institution, 0 to 1, meron po silang 0 to 1, 0 to 2, 1 to 2, 1 to 3, so on and so forth. Okay? But regardless of the policies of the institution on the reporting of your sediments, okay, always remember that for your RBCs and your WBCs, they are reported as average number per 10 HPF. Okay, so yan. Alright, so another, we have your casts. Your casts, they are significant. Okay, ayan. Ayan, they are significant and they are reported as average number per LPF. Okay, yes. So, significant po ang ating mga casts with the exception of your hyaline. Diba? Siya yung hindi masyadong significant out of the different casts that we have. Okay, so average number po per LPF. We have yours, ito, yung mga epithelial cells natin. Depende po. Ito yung sinasabi ko kanina na depende kung anong anong epithelial cell ang pinag-uusapan natin. So lahat po itong tatlong ito, all of them are actually epithelial cells. Yes. However, they differ when it comes to their significance. Why? Kasi iba-iba sila ng origin. Okay? Yes, iba-iba po sila ng origin. That's why iba-iba din yung degree of significance ng ating mga epithelial cells. Alright? So your squamous epithelial cells, they are not significant unless otherwise stated or otherwise specified in the question. Okay? Or unless otherwise deemed significant by the physician or by the doctor. Okay? But usually, in general, hindi po siya significant. Okay? So how do we report your squamous epithelial cell? It is reported as word per LPF. Okay? Your transitional epithelial cells, they are not significant if they are present in small numbers. However, with high numbers of transitional epithelial cells present in your urine sample, they may be significant. Okay? Or they are significant. So how are we going to report your transitional epithelial cells? They are reported as word per HPF. Okay? And then lastly, we have your renal tubular epithelial cells. From the term itself, renal tubular. Okay? Saan sila galing? They are from the different renal tubules of your nephrons. So since kidneys na yung origin ng renal tubular epithelial cells natin, they are considered to be significant. Thus, if you are going to look at the manner of reporting of your renal tubular epithelial cells, average number po yan per HPF. Okay? Oval fat bodies, are they significant? Yes, they are definitely significant. And so, ano ang manner of reporting ng ating oval fat bodies? We have average number per HPF. Okay? And then bacteria or yeast cells, so they are reported as word per HPF. Trichomonas, word per HPF. Spermatozoa, you just indicate the presence. Okay? Actually, lagyan ninyo ng asterisk yung spermatozoa na yan kasi it is dependent upon the policies of the institution. So like for example, in UBCL, hindi namin nire-report ang spermatozoa, particularly kung hindi naman minor yung patient. Okay? So hindi siya minor, meaning 18 years old and above ang kanyang age. Okay? So in certain institutions, there is a need to report for the presence of your spermatozoa, especially for minor patients. Why? Because it can indicate a possible medical legal case. Okay, ayan. Ayan. Pero syempre, hindi natin siya binibilang. I-indicate mo lang kung present or absent ba si sperm cell or si spermatozoa. Okay? Ayan po. So again, it depends upon the institution. Alright, so for your mucus threads, they are reported as word per LPF. Normal crystals, word per HPF. And then abnormal crystals, average number per LPF. Okay, so based on the manner of reporting, ano ang pwede nating gawin para mas mapadali yung pag-memorize natin when it comes to the reporting of your sediments. Ano ang napansin natin, class? Very good. Okay? Very good sa mga nakapansin. Ayan. Pag significant yung sediment, average number yan. Okay? Either per LPF or per HPF. Okay? With the exception of your bacteria. Diba? With the exception of your bacteria as well as your trichomonas, lahat na ng significant na sediment ay nire-report ng average number per HPF or LPF. Okay? Like for example, RBCs and casts. Significant? Of course. Kasi it can indicate bleeding. Diba? It can indicate, okay, a possible hematogenous origin or coming from your blood or circulation. So that means there's an injury. Okay? So kung significant siya, average number per HPF. Okay, casts. Significant ba ang casts? Yes, with the exception of your hyaline cast. And so, average number per LPF. Okay, RTE cells. Significant? Yes, average number per HPF. Oval fat bodies, significant? Yes, average number per HPF. Squamous epithelial cells, significant? No. Oh, word per LPF. Okay? Yan, normal crystals, significant normal nga eh. Okay? Word per HPF. Abnormal crystals, significant? Yes, abnormal nga eh. Average per LPF. Okay? So, ganun. Para mas madali nating i-memorize yung manner of reporting. Pag significant yung sediment, okay, in general, average number po yan per HPF or LPF. Okay, with the exception of your bacteria and your trichomonas. Okay, so yan. Alright, so erase lang po natin. Now, we have to be ready for the different sediments that we are able to see in your urine sample. Okay, so ito na. Ito na ang mga sediments na pwede po nating makita sa microscope. Okay, starting off with our valedictorian. First honor, we have your red blood cells. Okay, so your red blood cells in urine, they have an average diameter of 7 micrometers. Okay, they are non-nucleated, non-granular cells that are seen in our urine sample. Okay, yes, in our urine sample. So actually, when it comes to morphology, of your red blood cells, okay, there are two adjectives that we can use in order to describe the morphology of your red blood cells. Okay, so ano yung dalawang adjectives na yan? So first, we have your isomorphic. Okay, we have isomorphic, and then the other one is dysmorphic. Okay? So when we talk about isomorphic red blood cells, nawala. Okay, so anyway, when we talk about your isomorphic red blood cells, so ibig sabihin, the morphology is normal. Okay? The morphology is normal. So, there are no protrusions. There are no blebs that are present on our red blood cells. So, meaning, bilog po siya. Okay? Meaning po, bilog siya, walang protrusions or walang blebs ang present sa ating RBCs. The other adjective is dysmorphic. Okay? So from the term itself, abnormal morphology of your red blood cells. So the term dysmorphic is actually utilized in clinical microscopy in order to describe a red blood cell that contains blebs or bleb, okay, or protrusions. Yung merong mga protrusions po. Okay? Class just please do not mistaken blebs or protrusions to those that are present in crenated cells. Okay, magkaiba po yun kasi doon sa crenation, okay, doon sa crenation or shrinking of our cells, hindi naman talaga nagkaroon ng anong pangalan nito, ng abnormality when it comes to the cytoplasmic protrusion. Okay, yes. Remember that in the case of your crenated, RBC, it underwent crenation, okay, due to the tonicity of your urine. 'Di ba? Yung urine po ay hypertonic, kaya siya naging crenated. Okay? Hindi po dahil yung RBC mo ay galing sa Hindi po dahil ang RBC mo ay of glomerular origin. Okay? Nakuha? So, yung term na dysmorphic, isomorphic, these two terms are utilized to distinguish the origin of your red blood cells. Okay? In particular, ang dysmorphic na RBCs ay ginagamit for those who are of glomerular origin. Okay, ayan. So dysmorphic pag yung RBCs natin ay glomerular in origin. So remember that your glomerulus, it's still part of your cardiovascular system. It being a capillary. Nakuha? Ayan. Ayan. So ibig sabihin din class na all red blood cells which are not of glomerular in origin, we can refer to them as isomorphic RBCs. Dysmorphic RBCs lang pag glomerular in origin. Okay, so yan. Alright, so I think clear yun ha. Okay, so again, apart from the origin, ayan, we also make use of terms in order to characterize RBCs that are found in several, okay, tonicities or several osmolarities of your urine sample. Alright, so say for example, ang urine sample mo ay hypotonic. Okay, class. Kasi baka mamaya hindi hypotonic yung gagamitin na term doon sa urine sample natin. So take note ha, na pag sinabi natin na ang urine sample mo ay hypotonic. Okay? Pag hypotonic po ang urine sample natin, ibig sabihin yung urine sample natin ay dilute urine. Nakuha, mababa ang kanyang tonicity, mababa ang kanyang osmolarity. So dilute urine, so ito ay low, okay, low osmolarity, okay, or low tonicity. Okay, low osmolarity, low osmolarity or low tonicity. Class, itaas ko na lang ha. Okay, so ano yan? Dilute urine. Okay, in other words, hypotonic urine. Okay, so take note also na pag sinabi mong dilute ang urine, mababa ang kanyang osmolarity, mababa ang kanyang tonicity, pwede din po na ang gamitin nating parameter ay specific gravity. Okay, so a dilute urine sample has a low specific, okay, it has a low specific gravity. Nakuha? Ayan. So pare-parehas lang po yan ha. Dilute urine, urine with low osmolarity or low tonicity or hypotonic urine, urine with low specific gravity, pare-parehas po yan. Okay? And what term do we use in order to describe the cell found in your hypotonic urine. Okay? So ang tawag natin diyan ay, 'di ba, pag hypotonic, ano ang mangyayari sa ano ang mangyayari sa red blood cells natin? They will become swollen. Okay? Yes. So if they become swollen, ayan, if they become swollen, what will happen to them? There is a high likelihood that they will undergo lysis. Okay? So after ng lysis ng ating RBCs, ano ang mangyayari? There will be a release of the hemoglobin that is originally present inside your RBCs. Okay, so since there is a release of your hemoglobin, what will be left? Diba? Ano ang matitira is just the cellular membrane, the RBC membrane of your red blood cell. Okay, thus, after lysis at pagka-release ng hemoglobin, ang tawag natin dyan sa cell na yan ay ghost cell. Okay? Yes. So your ghost cell, tama ako. Yes, your ghost cell, this is seen in hypotonic urine as a consequence of cell lysis and consequent release of your hemoglobin. Ang natitira lang dyan ay yung cell membrane ng red blood cells natin. Kaya ang tawag sa kanya ay ghost cell. Okay, ghost cell. Ayan. So, in one of the references that we have in clinical microscopy, okay, may isa pang cell ang tawag or may isa pang term ang ginagamit in order naman to characterize red blood cells that are present in unfresh urine sample. Okay? So ano yung term na yan na ginagamit natin? Okay, so ang ginagamit po natin na term ay, so lagay ko lang ha, not fresh. Okay, not fresh na urine sample. Alright, so ang ginagamit natin na term to denote for the presence of red blood cells that are or that appear as faint, colorless. Okay, faint, colorless circles is the term shadow. Okay, shadow cells. Yan ang ginagamit po natin. So again, RBCs that appear as faint, colorless circles in urine samples that are not fresh, so they are referred to as your shadow cells. Okay? So ma'am, bakit sila nagiging colorless? So this is because of the dissolution. Okay, the dissolution of your hemoglobin in your urine sample. So since hindi fresh yung urine sample natin, ibig pong sabihin the RBCs have been in contact with your urine sample for a prolonged period of time, ano ang nangyayari? The hemoglobin that is present inside your RBCs will undergo dissolution resulting now to a faint colorless circle or faint colorless appearance of your red blood cells, and if this is the case, we refer to them as your shadow cells. Okay, as your shadow cells. So ibig sabihin class, magkaiba ang ghost cell at saka ang shadow cell. So kung kunwari ang natanggap mo sa laboratory ay dilute urine, urine with a low specific gravity or hypotonic urine, okay, at nakakita ka ng red blood cells na ang naiwan lang ay yung cell membrane, okay, ang tawag mo sa kanya ay ghost cell. Okay? Ma'am, paano naman pag shadow cell? Shadow cell ang gagamitin mong term if, for example, the urine that you received in the laboratory is not fresh. So, unpreserved urine sample po siya. It has been left standing for a prolonged period of time and causing now your RBCs to appear as faint colorless circles. So, ang tawag mo doon sa RBCs na yun ay shadow cells. Okay, magkaiba po yan ha. Okay, ayan. So, another is, for example, in the laboratory, you received a hypertonic urine. Okay? So pag sinabi naman po natin class na hypertonic ang urine sample, so i-characterize lang natin siya ha, yung sample na yon ay concentrated. Okay, so it is a concentrated urine sample. So meaning it has a high osmolarity. Okay, high osmolarity or high tonicity, kaya nga siya hypertonic, okay? And when it comes to the specific gravity is also high. Okay? Kasi baka mamaya hindi hypertonic urine yung gamitin nilang term. Baka mamaya ang ilagay nila doon ay urine with a high specific gravity. Okay? So what is the appearance of your red blood cells? So again, for hypertonic urine, the appearance of your red blood cells is that they will appear as crenated or shrunken. Okay, so I repeat, your cells will appear as crenated or shrunken. So that means our BCs are smaller than normal. Pag hypotonic urine naman, since they are swollen, they appear as larger or bigger than normal. Okay, so yan. So those are the different terms that we use in order to refer to your red blood cells in the different urine samples, okay, that we may be able to encounter in the laboratory. All right? So yan. So what is the clinical significance of your red blood cells? So take note that your red blood cells, katulad nga ng sinabi ko, they may be glomerular in origin. If, for example, they are regarded as dysmorphic, okay? So this can indicate glomerular origin of your RBC. Yes, and furthermore, it is associated with glomerular membrane damage. Okay, yes, glomerular membrane damage. So ano yung term na ginagamit natin for that particular RBC? Dysmorphic RBC. Okay? Yes. So if you are reading Susan Strasinger, ang sabi niya doon, when we say dysmorphic RBC, it refers to the presence of protrusions or blebs, okay, on your RBC membrane. Okay? Ayan, ang nagiging problema dito is that, okay, some references will not categorize a particular red blood cell as dysmorphic kung iisang bleb lang ang meron. Kasi pag dinedefine nila ang dysmorphic RBCs, lagi nilang sinasabi na presence of blebs or protrusions. So ibig sabihin more than one ang kinoconsider nila. Okay? However, there are instances wherein a particular red blood cell which is considered to be glomerular in origin will only have one bleb or one protrusion. Okay? And according to Henry, we should consider it as dysmorphic pa din. Okay? And in particular, Henry made use of the term G1 cell. Okay? Ang ginamit niyang term for a particular dysmorphic red blood cell containing only one bleb or one protrusion is the term G1 cell. Is it glomerular in origin? Yes. Is it dysmorphic? Yes. Dysmorphic pa din po siya. Okay? Ma'am, paano ba nagkakaroon kasi ng dysmorphism? Or paano ba nagkakaroon ng protrusions or ng blebs? Okay? Remember, if your glomerulus is intact, okay? If the filtration barrier is intact, okay? That means hindi dapat present ang cells doon sa ating doon po sa ating urine sample. Tama? Kailan nagkakaroon ng cells doon sa ating urine sample? Pag merong glomerular membrane damage. Okay? So that means the endothelium of your glomerulus is defective or it is damaged such that the cells which are present in your blood or inside your glomerulus will squeeze. I-squeeze po nila. They will squeeze themselves through the damaged glomerular membrane or through the endothelium. Okay? And this squeezing of your cells through your endothelium, it will result to the formation of protrusions or of blebs. Diba? O yan, pag kunwaring, sisiksik yung, para akong ano. Okay, sisiksik yung RBC. Diba? Syempre, pag sisiksik yan, okay, magkakaroon ng parang buntot yan. And that is the protrusion or the blebs, yung pagsisiksik. Kaya wag kayong siksik ng siksik dyan, okay? Yung pagsisiksik ng RBCs through the endothelium, doon nagkakaroon ng protrusions or ng blebs. Thus, nagkakaroon tayo ng dysmorphic RBC. Okay, ayan. So yan na, clear yan na. Pag ganun-ganun pa ako dapat naintindihan nyo yan. Okay, ayan. So another or another class, clinical significance of your red blood cells is if there is vascular injury within your genitourinary tract. Okay? So one good example of a possible cause of vascular injury is in the presence of your renal calculi. So take note na pag sinabi nating renal calculi, we are referring to your renal stones. Ayan. So if your renal stones go down your if your renal stones go down your genitourinary tract, of course, there is a possibility that they will lacerate the walls of your urinary tract. Okay? And if the walls of your urinary tract are damaged, then that is indicative or that means there is vascular injury. Okay, so again, kung may vascular injury, syempre, nagdudugo nga, okay, may bleeding nga, and your red blood cells will now be part of your or will now be present in your urine sample. Dysmorphic ba yung RBC? Hindi. Hindi siya dysmorphic. Kasi hindi naman nagsisisiksik yung RBC di ba? Nasugat. Okay? In layman's term, nasugat yung genitourinary tract mo. Kasi pwedeng meron kang renal stones, okay? Or pwedeng may injury to your genitourinary tract, nasugat siya, nag-bleed. Okay? Hindi naman sumiksik yung RBC doon pag nagbi-bleed ka, di ba? Okay? It is extravasation of your red blood cells due to injury. And so, the morphology of your RBC is intact. Hindi siya dysmorphic. Isomorphic yung RBC na makikita mo if it is due to vascular injury. Okay, so yan. All right. So just take note, class, that when it comes to your red blood cells, yes, one other sediment that is oftentimes mistaken as your red blood cells are your yeast cells. So yung yeast cells natin, take note, it is resistant to your acetic acid. And so, yes, how are you going to differentiate your red blood cells from your yeast cells? We have addition of acetic acid. Okay, so if it is, so kunwari, tumitingin ka under the tumitingin ka through your microscope, okay? And then may nakita kang mga cells. You are not sure kung RBC ba yan or yeast cells. So ano ang pwede mong gawin? Mag-add ka ng acetic acid. Pag nawala yung mga cells, ibig sabihin RBCs yan. If for example, after the addition of your acetic acid at nandun pa rin yung cells, pwedeng yeast cells yan. Okay? So yan po. Alright, so those are the things that we have to remember for your red blood cells. Okay, so apart from, sabihin ko na lang din apart from your yeast cells, your oil droplets and your air bubbles may also be mistaken as red blood cells. Okay, so under the microscope, your red blood cells will appear like this. Ayan, actually, very parang ganito yung nandoon sa picture na binigay namin or nandoon sa yes, nandoon sa discussion ni Sir Ruben. Okay? Ayan. So yan. Ayan po. Alright, so these are red blood cells. Okay, so you can see the biconcavity of your red blood cells. Actually, you are very lucky kung ganyan ang itsura ng red blood cells mo under the microscope. Okay, kasi sometimes ganito ang itsura nila. O, diba? Ang tsatsaka. Okay, itong mga to, probably nag-dry out na yung slide kaya ganyan. Hindi na ganun kaayos yung morphology ng ibang mga red blood cells. Okay, ayan. All right, so those are your red blood cells. And in order for us to appreciate or to understand better the effect of tonicity or specific gravity or concentration of your concentration of your urine on the morphology of your red blood cells, let us consider this one. Okay, yan. So ito ang normal. Okay, normal po ito. Alright, so that means the tonicity or the of your urine does not or is not affecting the morphology of your red blood cells. So if we are going to decrease the tonicity, okay, if we are going to decrease the tonicity of your urine sample, what happens to your red blood cells? They will become larger than normal. Okay, they will become swollen. Yes, and until such time that they will undergo lysis. Okay, so if you allow this to persist, okay, the lysis of your RBC, so this will result to the release of your hemoglobin and the contents of your RBC, leaving now just your cell membrane, yes, without the contents of your RBC. Kaya nagiging RBC ghost cell sila. Okay, ayan. So parang remnants yan ng RBC due to lysis, okay, in hypotonic urine. Alright, so if you increase naman the tonicity of your RBCs, what will happen to your RBCs? They will become shrunken, okay, or they will become crenated. They will become smaller than usual. Okay, ayan. So if you undergo or if you allow the crenation of your red blood cells to persist, they will appear like this. Okay? Ayan. So, ganyan. Crenated yung ating mga RBCs. Okay? So, yan po. Alright, so that is for your red blood cells. Yes, so siguro tapusin ko lang yung WBC and then end ko na. Okay, so another, we have your white blood cells. So your white blood cells, yes, your white blood cells. Alright, sige. Your white blood cells class, ayan po. So they have an average diameter of 12 micrometers, okay? And they usually or they appear as granular cells under the microscope. So the most common type of WBC that is seen in urine samples are your neutrophils, okay? So this is in conjunction with your urinary tract infection. So remember na pag sinabi nating urinary tract infection, it is bacterial, di ba? Usually bacterial in nature. And since the white blood cell that is needed in order to combat bacterial infections is your neutrophil, so ang pinaka-common din na white blood cell na makikita natin sa urine are your neutrophils. Okay? Your neutrophils. So they can be characterized from your RBCs by adding acetic acid. Okay, so we can also make use of acetic acid in order to differentiate your red blood cells from your white blood cells. So remember that your red blood cells, they lies in the presence of your acetic acid. Your white blood cells, on the other hand, they persist, okay, or they are not affected, they are resistant to the presence of your acetic acid. Okay, so apart from that, another point of differentiation is the cytoplasm of your white blood cells. So your white blood cells, they have a granular cytoplasm as compared to the non-granular cytoplasm of your red blood cells. Okay. Yes. So since there is a normal value for your white blood cell, okay, ibig pong sabihin, the presence of your white blood cell in urine does not always indicate a pathologic condition. So that's why in order for us to recognize that the presence of your white blood cell is due to a pathologic condition, we make use of the term pyuria. Okay, so when we say pyuria, so it refers to an increase. Yes, an increase WBC, the presence of increased WBC in urine. Okay, increased WBC in urine. So we refer to that as your pyuria. Okay, ayan. Okay, ayan. Ayan. So yan po. For the term glitter cells, okay, for the term glitter cells, this is utilized in order to describe or in order to refer to WBCs that are present in dilute. Okay, class, ilagay ko na lang dito sa gilid ha, kasi medyo mahaba ito. Okay, so WBCs in dilute, okay, or hypotonic urine, hypotonic, okay yan. Yes, WBCs in dilute or hypotonic urine is or are referred to as your glitter cells. Particularly, your glitter cells, they have a sparkling appearance. Okay, they have a sparkling appearance. Yes, they have a sparkling appearance, particularly what portion of your WBC? We have the cytoplasm. Okay, so the cytoplasm of your WBC has a sparkling appearance, and the sparkling, okay, the sparkling appearance of your WBC, so this is due to the Brownian movement, okay, the Brownian movement that is exhibited, ang haba nito, that is exhibited by the cytoplasmic granules. Okay? Exhibited by your cytoplasmic granules. So remember, ano ba kasi ang nangyayari sa mga cells natin if they are subjected to or if they are present in dilute or hypotonic urine? So of course, there will be an increase in the entry of your solvent into the cell. Diba? Yes, nagkakaroon ng increase in the entry of your solvent, in this case, your urine or your water, inside your WBCs. And take note that sa loob ng WBCs natin, there are granules that are present in the cytoplasm. So due to an increase in the fluid that is present in the cytoplasm of your WBCs, the granules na will undergo Brownian movement. Okay? Yes, Brownian movement, which is the reason or which is the cause of the sparkling appearance of your WBCs. Okay? So in particular, glitter cells are neutrophils. Okay, neutrophils po yung mga yan na merong or na nag-e-exhibit ng Brownian movement. Okay, the granules of which exhibit Brownian movement. Okay, we have your glitter cells. All right. So for your WBCs, there are several clinical significance for the presence of this in your urine sample. So it may be due to the presence of bacterial infections. So ano yung mga bacterial infections na yan? So we have your pyelonephritis. Okay, pyelonephritis pertains to the infection, bacterial infection of your nephron in particular, or okay, in particular of your nephron or your kidneys. Okay, pyelonephritis po ang tawag natin dyan. Bacterial infection naman of your urinary bladder is referred to as cystitis. Okay, ayan, pyelonephritis, kidneys, urinary bladder, cystitis. Okay, it could also indicate infection of your urethra, which we refer to as your urethritis. Or in males, it could also indicate infection of the prostate gland, which we refer to as prostatitis. Okay? Yes. So, pwedeng prostatitis po yan, especially among our male patients. Alright? And then, it could also be non-bacterial in nature. So, it could be due to glomerulonephritis. Okay? It could be due to autoimmune disease, disease such as your systemic lupus erythematosus. It could be due to inflammatory conditions or hypersensitivity, just like your interstitial nephritis, tumors also, or malignancies. Okay, so those are the clinical significance of your white blood cells. Okay? So ano yung itsura niya under the microscope? So again, sabi nga natin, it appears granular. So ganyan. Okay, it appears granular under the microscope. So we have here your white blood cells and your glitter cells naman, so they would appear like this. O, diba? They have a sparkling appearance due to the Brownian movement of the granules which are present in their cytoplasm. So again, white blood cells or glitter cells rather, so usually neutrophils po yan. Okay? Yes. So again, for your neutrophils, since sometimes they are or sometimes sometimes it's quite hard for us to distinguish them from your other cells, okay, particularly your renal tubular cells. Take note that your neutrophils, they have a light blue, okay, color if they are subjected to your Sternheimer-Malbin stain. Okay, so I repeat, ang kulay po nila, your neutrophils, their color in your Sternheimer-Malbin stain is light blue. Okay, light blue. O, neutrophils yan ha. Alright, so another important WBC that we have to take note of, if it is present in your urine sample, is your eosinophil. So again, anong stain naman ang ginagamit natin for your eosinophil? Okay, very good. We have your Hansel Stain. Okay, Hansel Stain. All right, your Hansel stain is utilized to provide color for the demonstration of the granules of your urinary eosinophil, and take note po of the significant value of your eosinophil. So an eosinophil differential count that is greater than 1%. Okay, this is class, ladies and gentlemen, considered as significant. Okay, so that is considered as significant, and it usually indicates interstitial nephritis, just like what I have mentioned a while back. Ma'am, nagdi-differential count din po ba tayo pagdating sa WBC sa urine? Yes. We also perform differential count. Yung differential count na sinasabi ko dito, hindi blood ang gamit natin ha. Ang gamit natin ay urine. Okay? And of course, if the value of your eosinophil is greater than 1%, okay, is greater than 1% in the differential count of WBCs in your urine, it is considered to be significant, and it is associated with interstitial nephritis. Okay? So katulad nga ng sinabi ko, your eosinophils, they play an important role in inflammatory conditions, particularly if we are considering hypersensitivity. Diba? Hypersensitivity reactions. Diba? From your immunology, your eosinophils, tagabantay yang mga yan. Particularly pag merong hypersensitivity reaction. Okay? So they are capable of releasing a particular substance in order to counteract the exaggerated response that is provided by your basophils and your mast cells during hypersensitivity reactions. Sila yung taga-control, diba? Taga-monitor doon sa exaggerated response ng basophils natin at saka ng ating mast cells. Kaya tataas din sila. Their numbers will also increase in cases of hypersensitivity reactions. Okay, such as in the case of your interstitial nephritis. Okay? Your interstitial nephritis, yan, your interstitial nephritis. So it may be drug-induced, okay, due to your exposure to certain drugs or to certain chemicals or toxins for that matter. All right, so apart from that, we are also considering decreased, ilagay ko lang, okay? We are also considering decreased numbers of eosinophils as significant, okay? So if, for example, your eosinophils are present in decreased numbers, so it can indicate urinary tract infection or renal, okay, or renal transplant rejections or rejection. Okay, so ulitin ko ha, pag increase siya, in particular, greater than 1%, okay, it is considered significant and it is associated with hypersensitivity reactions such as in the case of your interstitial nephritis. If your eosinophils naman are present in decreased amounts or in decreased levels, it is also considered to be significant. In particular, okay, it is significant in your urinary tract infection and your renal transplant rejection. Okay? So yan. Alright. Bali, banggitin ko na lang din dito kasi nabanggit ko na lang din. Okay, so how do we perform differential count of your urine sample? Okay, so your urine tuloy, the number of WBCs is counted. So in particular, you have to count 100 to 500, okay, cells, and then you determine the percentage of the different WBCs. Okay, ayan. So out of 100 to 500 cells, ilan ang eosinophil, ilan ang neutrophil, ilan ang mononuclear cells. Okay, so yan. So we also perform it in your urine sample. Okay? Ayan. So before I discuss the normal values in your urine, okay, so meron pang isang population of WBCs which you have to also be familiar with. We have your banggitin ko na ha, mononuclear cells. Okay, so for our mononuclear cells, okay, several cells are actually classified under this one. We have your lymphocytes, clinical microscopy ang pinag-uusapan natin class ha. Monocytes, okay, we have your histiocytes, yes, and of course we have your plasma cells. Okay, so we have your lymphocytes, your monocytes, your histiocytes, and your plasma cells. All of them are considered as mononuclear cells. So the presence of your mononuclear cells in your urine sample, so this indicates inflammatory, okay, inflammatory conditions, okay, or they may also indicate renal transplant rejection. Ayan. Ayan. So mononuclear cells, inflammatory conditions and renal transplant rejection. So in particular, what is the significant value if for example, based on the differential count, there is greater than 30%. Okay? If for example, greater than 30% of mononuclear cells are present, so this indicates chronic inflammation. Okay? So this indicates chronic inflammation. Ayan. Alright, so now let us go, nawala, ayan. So now let us go to the normal values of your RBCs and your WBCs in urine. Okay, so last na ito and then I will stop and continue. Okay, normal values in urine. So for our RBC, the normal value is 0 to 2 per HPF. So ibig sabihin, the presence of RBC in your urine is not automatically pathologic kasi meron tayong normal value. Okay? So same is true with your WBC. So there is a normal value for that, 0 to 5. So again, hindi ibig sabihin na meron kang WBC sa urine ay considered na siya na pathologic. Okay? That's why kanina when I was explaining the meaning of the term pyuria, increased WBC dapat. Okay? So you have to underline or you have to highlight the word increased WBC. Okay? Yan. So ibig sabihin greater than 5 per HPF. Okay? So yan. So those are the things that we have to remember when it comes to your RBCs and your WBCs. So I will end the video here and then again, let's see each other. Let's see each other again in the next video. Okay, so I'll see you. Bye. Bye.